Hello everyone, I'm Dr. Raul Ruiz and I represent California's 36th Congressional District. I'm also an emergency medicine physician trained in humanitarian and disaster aid and a public health expert with degrees from Harvard University both in medicine, public policy, as well as public health. And so I've been on the phone frequently with the administration responsible for the coronavirus as well as local agencies to ensure that, that plans and protocols are in place and that we're game planning any potential rapid spread. Right now, generally, the spread is still very low. There's the unfortunate death of an individual in Washington State. And we have a new development of the person in Northern California without an identifiable source of infection that person got it from. That's why it's important to calm anxiety by educating the community. The best way if you have anxiety or fear or great concern is to educate yourself about the virus. What to do to prevent from getting the virus, what to do if you have the virus, and what to do to prevent from giving it to others like your family. So the best source of information right now is at the Centers for Disease Control and Prevention, www.cdc.gov/COVID, COVID-19, COVID-19. There is a plethora of information there that you can read to educate yourself. Knowing the virus, knowing what to do will help calm anxiety and will help prepare you in case anybody around you gets ill. There's a lot of myths out there. I wouldn't listen to those myths. I would go to the source and get the information there. So COVID is a coronavirus that started in China from individuals shopping at a seafood market. It seems to have a rapid spread. The good news is that 80% of the cases are mild cases, and there are which is good and bad news, that there are individuals who can have the illness and not know that they're infected. That may be problematic for identifying who's infected in order to do the contact tracing and to isolate and contain. However, the coronavirus does have a 3% mortality, 2 to 3% mortality rate, and which seems low when you look at the total amount of people. You may have more numbers as the amount of cases go up because it is a percentage. To put it in perspective, the flu has a 0.4% mortality, and the coronavirus has a 2 to 3%. These are the symptoms. The symptoms are fever, coughing and sneezing, shortness of breath. Okay, so they're very similar to symptoms that one could experience with a common cold or with the flu or any upper respiratory like infections. So what do you do if you experience symptoms? All right, well, first of all, if you're sick, stay home. If you have a fever, don't go to school, don't go to work, and stay home. Rest, drink plenty of fluids, eat nutritious foods, boost up your antioxidants, that's what I do, and then wash your hands frequently. Whether you're sick or not, right now is a good time to just think about washing your hands frequently all day. The common source is you touch something or somebody coughs in the open and the droplets and the viruses that are in your hands or in the air gets in your face. So two things, wash your hands frequently, soap and water for about a minute, and then use the hand sanitizer and don't touch your face. get it out of the habit of touching your face. The other thing you want to do is if you are about to sneeze or cough, or you're feeling like you have cold-like symptoms, don't cough in the open. Those droplets can travel pretty far. So just cover your cough with your elbow and then wash your face, wash your hands. You can cough into a tissue, you can throw it away, but wash your hands immediately afterwards, and just always wash your hands. And you can also wash your face frequently as well. If these are the risk factors if you suspect that you may have the coronavirus. So one, if you travel to any of the regions that have a high population of coronavirus infections, one is the Hubei province, where the Wuhan city was, where this spread from that seafood market I mentioned earlier. And I would even add, if you were in those locations in Japan and the other countries that have a large spread now of the coronavirus, I would put your threshold of alerting, if you get symptoms, if you get sick, of alerting the hospitals and the public health departments in the county that you were there and you were sick. And you can always contact your healthcare advisor, your doctor, the nurse, and they have certain protocols to recommend to you to go into the hospital to get testing. But if at this point, if you were not in any of those areas, or the other criteria is that if you have been in contact with anybody known to have a positive diagnosis through blood work from the coronavirus, then if you get ill, then I would go in to the hospital, to your doctor, do the blood test, see if you're ill, and then they'll explain to you what to do to help prevent other people from getting sick. If you do have the coronavirus, which nobody here has it at this point, so there's nothing to worry about right now, but it's always safe to be prepared. Preparedness empowers you. Education and knowledge about the virus and what to do will empower you, will give you control of how to help your family, your friends, your community, and how to educate others to prevent the spread of this virus. Together as a community, we're going to be able to tackle this head on, and we're going to come out okay. I have faith, but we need to prepare for the worst and work for the best. So that's why I'm hoping that this information was helpful. If you have more questions, you can go to cdc.gov/COVID-19. That's a good area to start researching more about this. There's going to be more sessions like this as information develops, where I will be on social media and I will work with the other agencies in our county, Riverside County. I'll also be speaking with individuals from the National Institute of Health and CDC to bring you the most up-to-date information and to give you and to answer the most common questions that patients have, that families have, parents have, that I have heard throughout my experience as a public health expert as well as emergency physician here in our desert.